Today I want to talk about seasonal affective disorder, or SAD, the winter blues. It's something that I'm sure a lot of you have heard of. It's a type of depression with symptoms that mimic depression, but also include things like weight gain, overeating, oversleeping, social withdrawal. So overall, just those, winter blues. There's also a summer pattern type of seasonal affective disorder, but it's less common. You often hear about it happening to people in the fall and winter months. It's more common in the northern states, and when I worked at an inpatient psychiatric hospital, I was told that anybody that lives above Georgia doesn't get enough sunlight. I'm not sure if that's true or not, but it does make sense. It actually impacts a low number of the population, but you're at an increased risk when you have another mental health diagnosis. I was surprised to learn in my research that it does impact a low number of the population, because I feel like a lot of people, especially here in Pennsylvania, probably have seasonal affective disorder. Of course, women are at an increased risk. And the interesting thing about it is it's not concurrent. So you could be impacted with seasonal affective disorder one year and then not have it the following year, but then have it the next year. Only about 50% of the time is it concurrent. There's different kind of treatments for seasonal affective disorder, and I'm sure many of you have heard about them. There's therapy, so talk therapy, cognitive behavioral therapy, which, is helpful. There is, of course, antidepressants, so an SSRI medication. A lot of people will just take the antidepressants during these months whenever they feel that they're most impacted. There's vitamin D. So vitamin D seems to be a big thing, sunlight, different things like that, but there's actually little research that it helps with the symptoms. And then another one that seems to be more up and coming is light therapy. So light therapy mimics natural lights, and your prescriber can put you on it for a certain duration. From the research that I've done, it's usually anywhere from 20 to 45 minutes a day, every couple days, but there are special kinds of lights that you can have that help with this. And they actually make them so that while you're working at your desk, you can sit and do your light therapy. So it's convenient as well. Light therapy also helps with different things like jet lag, sleep disorders, and dementia, which, I work with the geriatric population. So, of course, whenever I saw dementia, made sense to me. So there's different things that you can do. The biggest thing that I have seen in my research is that it's important, if you have a history of seasonal affective disorder, to try to be proactive and get this treatment, take the medication, start therapy, do different things before daylight savings time, before fall and the seasons are starting to change and it's starting to get darker. A lot of people can tell that their mood changes when the weather changes, because it gets darker earlier. You just don't want to go out. You don't want to socialize. So it's important to talk to your provider to see if you meet the criteria for seasonal affective disorder, because again, it is a type of depression.